You have completed your initial assessment and take steps to address any deficits that you may have found and the patient is stable, it is time to address various other nursing interventions. Patients may have difficulty swallowing at first and require tube feedings and IV fluids may be necessary. They may also be incontinent and require catheterization. But be sure to remove the catheterization as soon as possible to prevent infection. And once tubes are removed, you must always assess their gag reflux and step them up on the diet. You start with clear liquids and progress your way up to solid foods. Motor impulses and movement may be impaired initially as well. Return of motor movement in the extremities occurs in stages. It may take hours or may take months to regain. Recovery may also halt at a certain stage. It's vital that you do everything possible to prevent contractures. Passive exercise, active exercise, strength building of the unaffected side, and early ambulation to promote return of muscle function are examples of some of the nursing interventions you can implement to prevent contractures. Once the patient starts progressing through the stages of recovery, safety becomes a concern. Unilateral neglect in which they're not aware of their affected side can be a problem. As they're ambulating, they can catch that side on things and cause injury to themselves. Teach them to frequently, it's also a good idea to teach them to frequently inspect their affected side for injury and protect it from harm. Safety precautions may need to be taken until they learn to compensate for a lack of judgment on the affected side of their body. There are many things to teach patients, including difficulties with speech. Instruct them to approach speech in an unhurried manner. There are also many communication techniques that can assist them while they are still working on verbal communication, such as communication boards. There are many assistive devices that can be taught to use in order to retain the highest level of independence possible. One-handed techniques for dressing and eating are also very important to teach. Medication teaching involves instructing them on the dosage, the route, the proper time, and many of the side effects that can occur with that particular medication. The prognosis for stroke victims varies depending on the degree they are affected, but with therapy and hard work, many stroke victims are able to return home and lead healthy and independent lives, which is one of our focuses.